Live from KFDM-TV, this is Live at 5.
A new study shows ovarian cancer is not the silent killer it once was. A significant breakthrough in the treatment of the disease is helping women spot symptoms and seek treatment earlier. Today on Live at 5, we welcome Dr. Scott McKinney with the Mamie McFadden Ward Cancer Center to discuss other findings of the study. Thank you so much for joining us.
Glad to be here, Jeff.
First, tell us a little bit about who conducted the study and what are some of the major findings.
This was performed in academic centers, University of Washington, and the big finding was a consensus with the Gynecological Cancer Foundation, and they pooled all the data and found that 4 symptoms were present in a high percentage of patients with ovarian cancer.
What are some of those symptoms that women need to look for?
The 4 symptoms were abdominal pain or pelvic pain, bloating or feeling of early fullness, and urinary symptoms, irritation, burning. These were symptoms that persisted for 2 or 3 weeks, not just a day or two and went away, but for about 2 or 3 weeks, and were fairly persistent and should cause women to seek their gynecologist.
Tell us a little bit about treatment and how effective it is now.
With ovarian cancer, when it's diagnosed early, very good survival. Unfortunately, most of the times it is in further advance. However, with a gynecological surgery and chemotherapy, a lot of women are able to go into remission and live with the disease. Now,
there is a genetic test that you can take to detect your risk of ovarian cancer. Explain how the test works.
In a small percentage of patients, it is genetically susceptible to ovarian cancer and breast cancer. And actually here in Beaumont, we have the ability to do that genetic testing. Not everybody has a genetic test for it, but it is a high risk in families. And if it puts you at high risk, you can detect if you carry that gene that puts you at very increased risk of developing ovarian cancer.
What does the test entail? Is it something that is painful, something that women
should be a blood test.
Worried about? Okay,
just
great.
A blood test.
Tell us a little bit about the Mamie McFadden Ward Cancer Center and things that you're able to do right here in town.
Well, as part of Texas Oncology, we have a statewide group, and we have a full-service cancer center. We have radiation therapy, we have chemotherapy, we have oncology-certified nurses, we have a laboratory, so really can deliver the full cancer care. Nowadays, cancer is not just done by one doctor, but it's more of a team approach, and you need multiple specialties. And here in Beaumont, we have that ability to do that.
All right. Well, we thank you very much for sharing this new information with us. We appreciate it a lot.
Thank you.